Today we're going to be doing my head-to-toe assessment, and before I begin, I will get my patient's vital signs, her height, weight, BMI, and we'll do the Snellen chart for distance, which tests cranial nerve number 2, and we will test near vision. To begin, I will perform hand hygiene, and I will introduce myself to the patient. So, hello, my name is Amy. I'll be your nurse today.
Hello.
And I will provide her privacy either by closing a curtain or shutting a door, and then I will explain the procedure to my patient. So today we're going to be doing a head-to-toe assessment, and so we're going to move around a little bit, and it's kind of lengthy, about 30 minutes, so if you need a break, just let me know.
Okay.
Okay? And to begin, I'm going to have my patient start in a sitting position, which she is, and we'll test her level of consciousness. And so I'm going to ask you a couple questions. What's your name and date of birth?
Lucy, my date of birth is February 2nd, 1999.
Alright, and where are you?
In the university.
University? Alright. And so I'm going to check her facial expressions, and her mood and affect, which are appropriate for the situation. And she is sitting upright, and her posture. And so then she has good hygiene, it appears, and her speech is clear. And so then I will move to her head, and I will just look for the shape of it. So she has an oval shaped head, and I'm going to inspect and palpate. So I'm just going to palpate for any masses, lesions, or abnormalities. I did not feel any. So now I'm going to move to her hair. I want to inspect and palpate. Is this your natural hair color?
Yes,
Yeah.
it is.
And so she has thick, dark brown hair, and it's evenly distributed. Okay? And now I'm going to move to her face. And so I'm just going to look and make sure it's symmetrical, which it is. And I am going to make sure it's symmetrical. Then I'm going to do my sinuses. I'm going to check her sinuses. I'm going to do the maxillary and the frontal sinuses. Is that tender?
No.
No? Okay, and now I'm going to have you, I want to test your TMJ, so if you can open and close your jaw. Very good. And that was doing the range of motion of her TMJ and looking for crepitus and things like that. And I'm going to have you clench your teeth together, and that test cranial nerve number 5. And I will have you do a series of facial expressions. So we're going to smile, frown, raise your eyebrows, close your eyes and balls together, show me your teeth, puff out your cheeks. Alright, and that tests cranial nerve number 7. So now I'm going to move to her eyes, and I'm going to look, and they're symmetrical. I'm going to look at the external features, so the lid, the sclera, the cornea, the bulbar conjunctiva, the lacrimal gland. I'm just going to look in here. Alright, good. And I'm going to feel for the nasolacrimal duct. Any pain or anything?
No.
No? So now I'm going to test for her pupil reaction. Good. Good. And that tests cranial nerves number 2 and 3. And now I'm going to do accommodations. So I'm going to ask her to look at the end of my pen and just follow it with her eyes, but don't move your head, okay?
Okay.
Very good. That tests cranial nerves number 3 and 4. And I'm going to test for extraocular movements. And so you're just going to keep your head still and follow the pen with your eyes, alright?
Okay.
Very good. And that tests for cranial nerves number 3 and 4 and 6. And the one before tested for 3, 4, and 6. I don't remember if I said 6. But now we're going to move to the ears. And so I'm just going to look at the auricle, the lobule, the tragus on both sides, and make sure they're symmetrical, which they are. And now I'm going to palpate the pinna, tragus, and mastoid. Good. Any pain?
No.
No? Alright, very good. So now I'm going to use the otoscope and inspect the external ear canal. Look for any drainage or anything. Alright, none. None on this side. And I also use the otoscope to inspect the internal ear canal, looking at her tympanic membrane. And I'll make sure to use my pinky to place it in her ear. Very good. Her tympanic membrane is a gray pearlish color, which is normal. So now we are going to move to her. We're going to do the whisper test first. And so I'm going to have you stand up. Okay, and I'm just going to whisper something behind you, and you're going to repeat what I say, okay?
Okay. pineapple. Purple elephants.
Alright, that's good. Sit down. And that test cranial nerve number 8. So now I'm going to move to her nose. And so I'm just going to look at the size, shape, configuration, and it's good. So now I'm going to palpate. Any tenderness?
No.
No? And I'm going to have, I want to test the patency of your nares. So if you could just hold one and breathe in and out. Okay, so the other one. Okay, and it's a little stuffed up, but it is allergy season, so that's pretty normal. And so now I'm going to look in the internal, of the inside of her nose. And so I'm going to look for turbinates, look at the septum and the mucosa using the otoscope. And her septum is intact, so that's good. So now I'm going to move to her mouth, and I'm going to inspect her lips, which are moist. I'm going to look at her teeth. So open up your mouth, good. I'm going to look at the buccal mucosa, which is also good. If you can open up your teeth for me. Her tongue is good, and here we'd usually palpate the tongue, but today we don't have gloves, so we're just going to inspect it. Good. I'm going to look at her hard and soft palate, which are intact. I'm going to look at her uvula, so if you can put your tongue out and say, ah. Okay, and that tests for cranial nerves number 9 and 10. And also I'll take a tongue depressor and push it against her at the side of her tongue, and that tests for the tongue strength, and it tests for for cranial nerves number 12. And I'll also grade her tonsils. And I'll say that that's about a 2. Okay, and so from now on, I'm going to move to the neck. So I'm just going to inspect and make sure there's no visible pulsations or no visible masses such as like the thyroid gland. And there's not, so now I'm going to palpate. Good, and her trachea is midline. So now I'm going to feel for her lymph nodes. And so I'm going to feel for the preocular, and you just tell me if you feel any tenderness, okay?
Okay.
The postocular, occipital, the submandibular, submental, the tonsillary, the post-cervical, anterior cervical, and the supraclavicular. Any tenderness?
No.
No? Okay, now I am going to test her range of motion, and so I will have you look around. Good. Look up and down. Very good. You can touch your ear to your shoulder. Good. And I'm just going to place my hand on the side of your face, and you're just going to look that way, okay?
Okay.
For resistance. Good. And this side. Very good. And so now we're going to move to your upper extremities, your arms. And so I'm just going to look at the color. Your temperature is warm. The color is good for her ethnicity. I'm going to inspect for any abnormalities I can see. I don't see any, so I'm going to feel for her brachial pulse. Okay, which is strong and regular, and I'm going to feel for her radial pulse. Okay, and that is also strong and regular. So I'm going to look at her hands. And look at the texture of her fingernails. There's no clubbing. That's good. I'm going to feel for, do the capillary refill, which was in at 2 seconds. So now I'm going to palpate her shoulder, elbows, wrists, things like that for any abnormalities or deformities. I don't feel any. Alright. And so now we're going to do some range of motion with and without resistance. And so if you can just move your arms around all over the place. Okay, now I'm going to put my arms in your arms and you're going to push up.
Okay.
Okay? Very good. Now I'm going to do it the other way. Very good. If you could spread your fingers out. Good. Now pull them back in. Alright. Very good. So now I'm going to do the shoulder shrug test. And so I'm going to put my hands on your shoulders and you're going to push up. Good. And that tests for cranial nerve number 11. And then I'm going to do fast alternating movements, rapid alternating movements. So I'm going to have you put your hands on your legs and just do that. Very good. Now I'm going to do the fingers, just like that. And that's also very good. So now I'm going to move to your posterior thorax, so if you could turn around for me. Okay. And here I would say that I have inspected and palpated the posterior thorax, so now I can auscultate. And I will do the 18 to 20 positions. Okay. take a deep breath in. I'm just going to move it. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, and 18. And since she does have a smaller body frame, I'll probably stop at 18. And I'll also test for her for the CVA tenderness, and I'll put my hand above her kidneys and use blunt percussion. And you just tell me if you feel any tenderness.
Nope.
Nope. Okay, we can go ahead and turn around. So with the anterior thorax, we have already inspected and palpated, and so now I just have to auscultate. So I want to listen for the 10 positions. So 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. And here I'll also test for skin turgor and mobility by pinching the skin on her clavicle. Good. And the skin returned back to normal. So now I'm going to ask my client to lay at a upright position kind of. And here we would inspect the jugular vein. And we will inspect the carotid artery also. And we will inspect, palpate, and auscultate. But I will auscultate before I palpate. Then we will auscultate for the apical pulse and for heart sounds. And so from then on, we're going to move to the abdomen. And I'm just going to have you lift up your shirt if you would, please. Okay, and if you can just lay flat with your arms by your side. Now I'm just going to look at the curvature, which is flat. Look at the color of the skin, which is a little bit paler than her extremities, which is totally normal. And then I'm going to look for this symmetry, make sure it is, which it is. So then I'm going to auscultate first in all 4 bowel regions. Alright, pretty good. And her bowel sounds are normal. So now we're going to palpate, starting with light and go to deep. So you tell me if you feel any tenderness, okay?
Okay.
Any?
No.
Now going to do deep. Any?
No.
Alright, and we're going to move to your left so you can cover up your stomach if you like. So I'm going to look at her lower extremities, look at the color, look at the distribution of her hair, which is even. I'm going to feel for the temperature. Okay. And her legs are warm, but her feet are a little cooler. And I'm going to feel for her pulses. So I'm going to start with the popliteal pulse, which is behind her knee. Okay. And now her dorsalis pedis. Good. And her posterior tibial. Also good. And we will check for her capillary refill and her toes. Alright. And I'll also check for edema. Very good. Now I'm going to palpate her joints such as her hips, knees, ankles. I do not feel any abnormalities or masses. So now I'm going to have you sit on the side of the bed, and I'm going to do your patellar reflex.
Okay.
Okay. And we can use a reflex hammer, but today I'm just going to be using my hand. So I'm going to feel for it. Very good. Very good. And so now we are going to have you stand up. And I'm just going to look at the curvature of her spine. Very good. You can go ahead and turn the other way. This way. Yep. And I'm just going to feel her spine, make sure it is midline. and feel the musculature around it, and that's good. So I want to have you bend over and touch your toes if you can. Alright, and her spine was midline. I'll have you stand up, and we're going to have you walk a little bit, if you will. Okay, and her balance is good, so now on your way back, I'm going to have you walk heel to toe. Good. And so now we're going to do the Romberg test, so I'm going to have you put your feet together, have you close your eyes with your hands by your side, and you're just going to stand like that for a minute or two. And while she's doing this, I want to see if she's swaying. Okay, and she has very little movement, so that's good. And so now we're going to do the finger to nose. So I'm just going to have you put your arms out and do just like this. I'll have you close your eyes and do it. Alright, very good. So, and that was my head to the assessment.